What should I do if someone I care for is refusing medication?
Yeah, that's a tricky one.
Mm-hmm. And it depends, doesn't it? I think people need to, again, back to all of us, we need to feel a sense of being in control of our lives. So it depends what kind of medication it is. Some people are on medications that if they don't take one on one day, that's fine. Yeah. Some people are going to be on absolutely essential medications that they need to take. Depending, again, because it does depend on the medication, whether it needs to be administered or if a person's able to take it themselves. Sometimes leaving a few out in the dish that a person can take, if the specific timing isn't necessary, they'll feel in control of that. But coming back, giving it a break and then coming back for those really essential medications that need to be given at a specific time can be very, very helpful.
Well, I have a slightly different take on this because of Trisha's condition. A type 1 diabetic who has managed her own diabetes for 50 or more years in difficult circumstances. She used to travel the world on her own and be in situations where maintaining her control of her diabetes was difficult. She is absolutely convinced that she is the best and only person that can decide when she has her insulin, when she tests for it, and what she should eat afterwards. That's becoming more difficult as her memory goes, but there are other things kicking in that nobody seems to quite understand. Her perception of blood sugar levels based on how she feels has gone completely to pot. She will get a headache or a shake that she knows absolutely instinctively is a sign of low sugar. She has not got low sugar. She's got a monitor on her arm. She can do blood tests and so on. And her sugar is not low, but her brain is telling her that it is. And that's complicated. That's very complicated because her instinct is to reach for something that will give her instant sugar because she knows, not thinks.
Yeah.
She knows she's going low. That might not be the case. She will go for the Lucozade. And some of your carers have got to the stage of planting fake Lucozade in the fridge.
Great creative solution. Brilliant. Brilliant.
It's coloured water, but it isn't loaded with sugar.
With sugar.
Because she will get to a shouting match over her medication. And it's one of the hardest things to manage.
Well, actually, when somebody is refusing medication, they have those 6 rights. So one of the rights they have is to refuse it.
Yeah, absolutely.
But sometimes when we feel that this is absolutely detrimental for their health and it's a risk of life, we need to preserve the life. And in that case, we might have like a multidisciplinary meeting and put like whatever we call deprivation of liberty dolls in place. Yeah. So when we do that, actually maybe then you will, because you can't just put the medication in the yogurt and just give it to some, you need to give them that dignity, they know what they're doing. But if we feel that we need to preserve the life, we might have those things in place so that actually somebody then can say this medication is vital for this person and this needs to be given covertly. So this is, I think, the last resource. The last resource. But before that, we need to be trying everything else, like the Lucozade bottle in the fridge, so that she can see that and say, okay, I'm having the Lucozade.
Yeah, absolutely.